Welcome to session number 9 in the audio series Overcoming Social Anxiety, Step by Step. Here at the Social Anxiety Institute, we have a behavioral therapy group meeting for people with social anxiety once a week. We have held these behavioral therapy group meetings on Tuesday and Wednesday nights and on Saturday since our original behavioral therapy group started in 1994. You have already heard the story I'm going to relate to you now, but I am deliberately going to summarize it again for you because of its importance. This message must sink down into your mind so that your thoughts and beliefs can be permanently changed. One evening, as I was walking into our behavioral group meeting room, I heard one of the participants say, "Oh, I just hate going around that circle. The thought of it scares me to death. While I'm waiting for my turn to come, I think I'm going to die. I just hate it." The person next to her agreed. All that anticipatory anxiety just builds and builds and builds. It's so scary. It's the part of the meeting I really hate the most. When I heard what was being said, I knew it was time for a little talk. The woman who made that statement was a woman who had just successfully, and very professionally I might add, given an informal and formal introduction when it came her turn. She had also given short talks and impromptu speeches by this time, when her turn came around in the circle. She was actually very good when the spotlight was on her, and we were reinforcing that by continuing to go around the circle. But I could see now that this wasn't enough. We needed to do several more things. We needed a name for the process of going around in the circle or around in a group, waiting your turn to introduce yourself or to say something. A name that would indicate its difficulty for those of us with social anxiety, but also a name that would allow us to see it in a different light and from a different perspective. One of our members came up with the name we are still using today. We call it the Circle of Death. Whoa, you say, that sounds negative and ominous. Maybe, but when you think about it, not really. Even from the beginning, the name was such a paradox that everyone laughed about it. It is like, yes, the circle is difficult for us, and yes, none of us like the anticipatory anxiety that the circle causes. But, does it cause us to die? Is it that extreme? Is it really the end of the world? And don't I usually feel better as I start talking? The group members, in fact, took to the name quickly, laughed about it, and it has been the name we've used in our behavioral therapy groups ever since that time. In fact, when people are moving up on their anxiety hierarchy and are feeling a little better, a little less anxious, and a little more confident, they will suggest, "Why don't we go around the circle of death today?" But back to my original story. The circle was bothering people, and they were verbally talking about how horrible it was, even though they had done a very good job when their turn came around to say or do something. I had to ask the group an important question. Do you remember the handout about turning the tables on the ants, part 3? The handout that explains why the brain hears and believes everything you say? There were general nods of agreement around the room. Well, I said to the other group members, what do you think of what you just did in the last circle of death? Were your presentations okay? Good? Bad? Neutral? What do you think? Everyone sounded good to me, one man remarked. Yes, everyone was good but me, said a woman, expressing a common but ant-like belief. There was more head nodding. Everyone seemed to agree that everyone else at least had done a very good job. And we're not looking for perfection, I reminded them. We're all human beings. We're all entitled to make mistakes, and every one of us makes them. But you did a very professional job a few minutes ago. I wasn't lying, by the way, or trying to build up their confidence. If I did that, it would not be helpful or therapeutic. If something needs improvement, I think it's important that I gently bring this to people's attention. Part of my role is to be rational and to encourage everyone else to be rational as well. They continued to nod their heads, some of them realizing the truth of my words, and some of them nodding because everyone else was nodding. Well, what did you think about Susan's introduction? I asked. Very good, came the immediate reply. She really sounded very professional. I couldn't hear any anxiety in her voice at all. There was more head nodding throughout the circle. I caught each of their eyes before moving on. Then, you know what? We have a problem. This time there were no nodding heads, just quizzical looks. It seems to me that all of you did a good job at what you chose to do in the circle of death. You just told me you thought Susan did a good job and that she sounded professional. No one said anything, but the head nodding returned. Well, if all of you did a fairly good job, then you're handling the behavioral end of this therapy pretty well. The problem is that you're not bringing the cognitive therapy into it. At this point, there were more puzzled looks. What I mean is that despite the anxiety you are feeling, you still did a good job at whatever you chose to do in the circle of death. We just went around the circle. You gave your introduction, your talk, your presentation, or an impromptu story, and all of you did a pretty good job. In fact, I don't think another group of people anywhere could do a better job than you just did. I paused again to try to let the next sentence sink in. But you're telling yourselves a lie. Some of you commented on how you hate the circle of death because it is so horrible. Now stop here. Let's be rational. Number one, you just did a better than average job. Number two, you all sounded good. You even said the others sounded professional. Number three, so the circle can't really be that bad. You're actually getting quite good at it. You've been making progress each and every week. Progress that has been noticeable to everyone in the group, including me. Now we need to start telling our brain the truth. Something like this. Hey, wait a minute. I did a pretty good job. I may not be perfect, but I did just fine. So talking in the circle is really no big deal. It's not something I especially enjoy just yet, but it also isn't the end of the world. I am going to continue on with this rational attitude and just keep going. Because your brain hears everything you say, you don't want to be telling it you hate to go around the circle of death and do something when you can actually do it just fine. All the behavioral therapy you're doing will not be effective unless you start telling yourself the truth. Stop saying you hate going around the circle of death. Replace that statement with a more honest assessment. Say to yourself, I have never particularly liked going around the circle of death and introducing myself, but I am doing it right now, and I'm doing a pretty good job. Each week, this gets a little easier and easier. The circle is not as big a deal as I've made it out to be. I think I may be blowing things out of proportion again. By making a statement like this, you are putting the cognitive therapy together with the behavioral therapy. You're doing what you need to do to get better, and you're telling yourself the truth about what you're doing. When the cognitive and the behavioral mesh together like this, everything works better and happens faster. Our circle of death is paradoxical and funny. It is true that people with social anxiety do not like to start going around the circle, waiting their turn, and then saying something. But everyone knows that to get better, it's part of the therapy that needs to be done. We generally start on the circle of death the second or third week of the group. And the amazing thing is that people get very good at introductions, reading, presentations, short talks, or whatever they've chosen to do very quickly. In fact, in the group I told you about at the beginning of this session, each and every group member came across very well within about 3 weeks. I told them the honest truth when I said they had done a better job of making introductions and presentations than they would find in the business world. They were genuinely good. But their brain still hadn't caught up with what they were able to do. Each of the group members was amazed at what the other members were doing. But when it came to themselves, they didn't feel yet like they had improved quite that much. Those old beliefs, of course, are ants' lies, and the more we are able to identify them as ants' lies, the better. So we quickly get into the circle of death is fun mode, because the more we say this and repeat it, the more true and accurate it becomes, provided you actually are working on the behavioral therapy. Your brain hears everything you say and tries to take it literally. So be careful. Don't say you hate something. Don't say you can't do something. Don't say something is